So, good day, Miss Love. Good day, everyone. So, today I will be discussing the chapter 34 of the book, which is Child Health Assessment. So, unsa maning Child Health Assessment? So, Child Health Assessment is to promote children is not just physical, but also the mental health of the children to to knows the health status of our children. So in child health assessment, it evaluates a patient's or uh, a child in general assessment. So as well as the physical, psychological, and social functions, but and also involves any considerations of whether preventive in health treatment and education. So naay five objectives of child health assessment. So first is describe the purposes and techniques of health assessment in children of all ages. Identify 2020 national high goals related to health assessment of children that nurses can help the national achieve. Third is assess a child and family by health interview, physical examinations, and the developmental screening. Fourth is to formulate nursing diagnosis based on health assessments. Findings, and the last is identify expected outcomes based on health assessments, findings, as well as help parents to manage seamless transitions across the different healthcare setting. So, the next is health history. So, um, health history are establishing a database. So, unsa man purpose aning the purpose of establishing a database. So, in assessment, a young children begins with an interview of the parents. Syempre, ang purpose jud ani syempre ang like newborn sa mga bata na nag-edad 1 to 5. So, syempre dili pa man jud sila kabalo motubag sa kung i-interviewhan ninyo sila as a health worker sa imong community. Interviewhan ninyo sila about sa ilang health. So, dili pa sila kabalo motubag. So, syempre, about ang mga questions. So, need na to inyang parents to guide and to answer the questions the way we conducting an health interview. The second is adolescents and pre-adolescents may be choose to be interview without parents present. So, like adolescents kita, so, makaya naman nato na motubag ta sa mga questions if ever pangutan ta. So, no need na atong parents. So, but dili jud man kayan nga nadyo uban ng mga adolescents na kanang maulawon. So, need pa nila ang ilang parents na mutubag sa mga questions if ang mga health worker is mag-conduct of assessment. Interview rather. So, the third is the purpose of health interview is to gather information that will direct physical or laboratory examinations to complete through health evaluation. So, ang purpose sa health interview is kanang nagagather sila og more informations and also kanang direct na physical or laboratory examinations para makompleto ang makomplete ang health evaluation. The way if we conducting health interviews like in our community. So the next is important principle of child health interviewing includes establishing conducive interview setting. So unsa man ni? So in interview setting, so I know na nakabalo na mo ani na discuss na ni Sir Mark or ni Miss Love the way ta mag-interview or mag-conduct ta og interviews sa ka-patients. So, need an interview is the best conducting in a private room with all parties seated and comfortably. So, when as a health worker, when we conducting health interview sa ka-clients or sa ka-patients, so, dapat na dito sa private room ka na. Both ikaw, patients, o health worker, ang naradyudraan na wala ang makadungog. And also, kanang be comfortable ta sa when conducting a health interview. Comfortable ta sa kanang para ang purpose ani para magkasinabtanay ta both patients and health worker. So during the interview, so a healthcare provider can appear rushed and also unable to enter eye-to-eye level during interview. So again, discuss na ni Miss Love or ni Sir Mark sa community health nursing. So when we conducting health interviews, so kanang dapat ta ka eye-to-eye level for you to comfortable and para it's easy to us as a health worker na magkasinabtanay ta sa ato ang pasyente or a clients. Then also ang clients pod makabalo or dali ra siya makasabot kung unsa atong gipang instruct sa ilaha about sa ilang medication, about sa ilang health status karon. So na two types of questions that in interview setting that is conducted an interview setting, the closed-ended questions and open-ended questions. Pag moingon tag of closed-ended questions, I think na naagian na ninyo sa senior high katong nag-thesis. Nato di ay rather na naagian na ninyo nato about aning closed-ended questions and open-ended questions. So, pag moingon tag closed-ended questions is mo ni siya ang simplest questions forms that they directly ask for a fact that such as kanang an effective type of question is particular in effective questions that a particular point of being sought is limited lang, and also the scope of question however, because the response is usually by use yes will be a yes or no, so with further elaboration. So in short, kung ang close-ended question is muna ang mga questions nga na ay limited na answer lang, like yes or no. While ang open-ended questions is kanang allows to elaborate in contrast to closed-ended questions. So it is important to ask open-ended questions with school age, sa mga school age na children and adolescents that they encourage to fully describe. So, maka-discuss naman na sila or maka-describe naman sila kung unsay problema about sa ilang health status. So, ang open-ended questions is muna siya ang mga questions na any forms of answers like mga pangutana na kinahanglan lang o in short, opinionated answer lang. So, ang there are three types of effective questions. The first is compound questions, the expansive questions, and leading questions. Kung moingon tag compound question, unsa ni siya na question? So, ang compound questions is should be avoided if all possible because of informations by elicited and dili siya accurate and must be followed by a clarifying question. So just and also, while ang expansive questions is same ni sila sa open-ended questions that gone wrong because the questions be asked to vague to answer. So, however, these questions is maybe limits the questions make is answerable. So, while leading questions, ang leading questions is muna siya ang kanang leading questions is supply their own. So, naga-supply sa patient's answer. So, they should be also be avoided that the results of such kanang unsa man, such as engage could be a child live vulnerable disease. So, the next is contents of health interview. Unsa maning contents of health interview. So, while conducting, this is the most important part while conducting ang health interview to our community. So, as a health worker, we need to use this kind of contents of health interview. So, first is introductions and explanations. So, unsa maning introductions and explanations? I know na nakabalo na taani kay during RD nato, so mumudyo ni atong dapat buhaton. So while conducting ang health interview, you should introduce, so as a health worker, you should introduce and explain yourself. So as a matter of a courtesy, so you should introduce yourselves kanang, maingon ka na, Hello, ma'am. Good morning. This is Kristen May Sabayog from BS Intuit. So today I will be teaching to you on how to nangingana. So, muna siya ang importante. Ang unang dapat buhaton kung while conducting an health interview. So, the next is demographic data. Unsa may sulod ani demographic data? So, ang demographic data is kanang refers to a data muna siya ang kanang pangalan sa children. Example, ang patient data is child. So, pangalan sa children, name of a person who will be providing information. So, name sa tao na kanang pwede na to ma-interview about sa health sa imong sa children. So the next is to provide culturally development competent care and provisions for special needs such as culture, ethnicity, ang place of birth niya, para dali ra nato siya ma-justify kung asa ni siya nagpuyo or ingana, kung unsa kalayo ang ospital sa ilaha gikan sa ilang balay, so ingana. So, also the religious or spiritual practices and primary and also the secondary language should be also be identified. So, be certain to identify in primary caregiver. So, as it is especially important to identify custody of the child of who has the right to sign the kanang consent na example kung i-admit siya. So, naman siya dapat na mubantay anak niya. So, dapat mo perma atong consent na nagpamatuod nga siya ang guardian ani, then siya ang nagbantay ani dito sa during na-admit siya. So, the next is chief concern. Ano sabi ng chief concern? Ang chief concern na baya is na ay 6 ka mga aspects of problems that problem. So, first is durations. The second is intensity. The third is frequency. The fourth is description. The fifth is associated symptoms. And the last chief concern is actions taken. So, the next is history of chief concern. Ano sa maning history of chief concern? Ang chief concern, history of chief concern is a family profile ni siya, documentation circumstances of child lives. So, a good introduction to health and family profile is a sentence such as so nana siya mga questions diri but dili na lang nato para mamubuk na lang sila. So, kuan ba kanang ang example ani kanang ma'am kanang kasado ba mo sa imong bana or single ba ka karon? Kanang ingana sa pagpuyo sa inyong balay ma'am ang na kuan ba ma'am, extended ba mo, nuclear ba mo, or blended. So pila ka buok children na nagpuyo sa inyong balay ma'am, ingana. So the next is day history. Ang day history is current skills, that sleep patterns, hygienes, and also the eating habits of and interaction with the family can all be elicited by asking parents to describe the typical, which are the day, the play, the sleep, and the hygiene, and also the nutrition of the child. So, example sa play, kanang ma'am, kanang ginapasagdan ra ba nimo na nagadula ra siya isa, ingana. So, unsa jud mga paborito aning madulaan nimo? So, pangutan ani mo about siya ang play. Sa sleep, ma'am, kanang unsa ni oras matulog pagkagabi, ma'am? Kanang need ba nimo siya pukawon, ma'am? Kanang kung pamathon siya ma'am or siya lang mismo ang mubangon, kanang pila pud ka oras iyang tulog ma'am. So muna ang question sa sleep. So while in hygiene, so ma'am kanang nagaligo ra ba na imong anak og siya ra isa ma'am? Kanang kabalo manghunaw ba na siya before mo kaon siya ma'am or magunit siya snack ma'am? So the next is the nutrition. So, ang important is kanang nutrition that kanang food nga gina-intake niya every day. So, taking a history of child food intake is to help to determine whether the food missing or kanang food missing or typical plan, or if any question is adequate or excessive. So So the next is past health history. Unsa man yung past health history? So ang past health history is kanang mga past niya, kanang ma'am, kanang unsay past history ani niya ma'am, kanang nakaagi na ba ni siya chickenpox ma'am, measles, mumps, or serious illness ma'am. So inquire that also inquire should be ma'am, kanang na-complete ba nig immunize imuhang anak? So pangutan-on nimo kay apil man siya sa past history. So imo siyang pangutan-on. So the next is kanang kuan past history including pregnancy history. So ang importante jud if ever kung newborn imuhang patient, so need na to ang iyang kanang pag-pregnant sa iyang inahan. So health children affected by mother's health during pregnancy. So mo jud ni mostly na mga hitabo kung unsay health sa mama, so mas nay possible na matakdan ang kanang anak. So pangutanan nimo ma'am, kanang naba kay ini complication ma'am, nakaagi ba ka og kanang bleeding ma'am, kanang nakatry na ba ka na magbasa imong kamot og imong tiil ma'am, swelling, kanang taas ba imong blood pressure, kanang nakaagi ba ka weight gain or loss, kanang ingana. So pangutanan nimo siya. So kanang ma'am, kanang sa imong pagbuntis ma'am, naga-use ba ka og cigarettes, naga-drink ba ka og alcohol, kay and also the use recreational drugs while she is pregnant. So did the pregnancy end early or late, kanang ingana. So did she take any medications? So kanang ma'am, sa imong pagbuntis ma'am, naga-take ba ka og medication ma'am? So muna mo pangutan. The next is family health history. Unsa man yung family health history? Ang family health history is kanang like inherited ni siya or familial, kanang gikan sa imong mga kaluluhan na sakit. So it is important to know which is one stand. Example, kung ang sakit sa bata is kanang kuana siya kidney problem or tuberculosis. So kanang para mas madali ang pag-assess sa children. So ma'am, kanang naba mo'y kaliwat na sakit na tuberculosis ma'am, allergies, STR, sexual transmitted infections, or cardiac disease, or kidney disease, or kanang seizures, diabetes na type 1 or type 2. So para madali ang pag-assess sa children. So pangutan-on na nimo siya kay apil man na siya diri asa when conducting a health interview. So the next is review of system. Unsa man ang review of system? Ang review of system is kanang health interview is kanang summary na ni siya of the in general assessment of the body, the symptoms of a review of system. So this is a lot of general takes no more. So general takes more than 5 minutes, but however that's through the questions is quickly done. Parents does not have time to answer begins to believe that interview and only unimportant that the child in any symptoms that's described. So mo ni siya. The next is physical examinations. Ano sa maning physical examinations? When ang physical examinations is mastery of physical examinations that is an essential ni siya to incorporating physical assessment, data assessment step, or nursing process, or physical assessment along with health interview is most frequently practice and skills. So